Are lining up on street corners all across the country, protesting cuts to federal VA personnel, some even hitting Alabama workers. This all happening as the Trump administration is instructing the VA to cut close to 80,000 more employees. Alabama veteran leaders are questioning those protests by saying, quote, "There's no need to worry." WAFF 48's Nick Ballinger spoke to the state chair of the Vietnam Veterans of Alabama and heard what he's been hearing and told by lawmakers firsthand. Nick?
Yeah, Margot, a spokesperson for the Birmingham VA even tells me some are happening right here. Wayne Reynolds says he thinks some of these cuts are necessary. He even says there should be more. All across the map, veterans are protesting cuts and looming ones to the VA affecting close to 80,000 employees. Ohio, North Carolina, Virginia, and even right here at home in Huntsville.
Personnel cuts are horrendous. Take action to prevent the VA cuts that are directly impacting veterans and their health care.
More than 1,000 probationary employees were laid off last month with the expectation to save the government $98 million per year. Some firings even happening in our state. A spokesperson for the Birmingham VA says, quote, "The Birmingham VA healthcare system has dismissed a small number of probationary staff this month. This decision will have no negative effect on veteran healthcare, benefits, or other services," end quote. The federal VA, which oversees healthcare, may have cuts, but a spokesperson for the State Department says it hasn't had any yet. Alabama State Chair of the Vietnam Veterans of America, Wayne Reynolds, says the services speak for themselves.
I see no difference. My VA check arrives. I've been able to see my providers. I've been able to get care.
Lawmakers on both sides of the aisle say veterans' care is still a top priority. The new government funding bill signed earlier this month adds an additional $6 billion for VA operations.
But the continuing resolution speaks for itself, that both parties allowed it to be passed, and it provides more money for veterans.
Reynolds is even doubling down on the cuts, asking for more.
But there's a difference between surgical cuts that are appropriate, and there are some people, quite frankly, in the VA that need to be removed. If my fellow veterans thought it was that great that nobody needed to be replaced, it would be different.
Now, the push to fire close to another 80,000 probationary employees is geared at reducing the size of the VA to 2019 levels. But it's still unclear what effects those cuts could have on health care. When we learn more, we will keep you updated. Margot?
All right, thank you.